Hello, my name is Josh.
And my name is Heather.
Together, we are here to talk about A.L.S., otherwise known as Lou Gehrig's disease, after the famous baseball player who was diagnosed with the disease in 1939. It is important that people know what A.L.S. is and how it works. The cause is not known at the time, but genetics may have something to do with it.
My uncle was recently diagnosed with A.L.S. in November, so I am fairly new to the disease. Before his diagnosis, much like most of you, did not know what A.L.S. was. I now know that A.L.S. stands for Amyotrophic Lateral Sclerosis and is a disease of the brain and spinal cord nerves that control voluntary movement.
A.L.S. is a progressive disease and is fatal once it has run its course. There is no known cure, but some treatments have been developed to slow down the disease and prolong life.
A.L.S. will continue to affect the muscles of the body, and progressive loss of function is inevitable. One aspect that is of particular focus is the weakening of the muscles that control the vocal bands, which will eventually lead to vocal cord paralysis or paralysis of the vocal bands.
Although it is very much different from aphasia, it is similar in that both can cause an inability to speak. Vocal cord paralysis would be better described as a voice disorder. In the case of patients with A.L.S., electrical stimulation can be used to activate the vocal bands. But there is no chance of spontaneous recovery.
When that happens, the patient is likely to try ALS or augmentative alternative communication devices to continue communicating with individuals. Sign language is not a viable option for patients with A.L.S. because their arm muscles frequently weaken before any other muscles.
Because A.L.S. affects the muscles in this particular area of the throat, swallowing becomes an issue as well. As with the first issue of voice disorder, there is no chance of spontaneous recovery.
To avoid all the problems that result from not being able to swallow, the usual procedure is to insert a feeding tube through the abdomen. This allows the food to bypass the inability to swallow.
One of the most common complaints of those with dysphagia is the longing to be able to eat real food. When a feeding tube is installed, the sensation of taste is never utilized, and savory treats like chocolate or steak can't be eaten. This causes the patient much angst.
The best approach for a patient to overcome these difficulties is counseling, and A.L.S. presents many problems that would already warrant such action. Coming to grips with the reality of never eating food again can be hard, but with help the patients can overcome this problem.
I hope this message has enlightened you to some of the pressing issues of A.L.S. and its relationship with communication disorders. Although there are no real treatments for the communication disorders present in A.L.S. due to it being a muscle weakness issue, the disorders are present nonetheless. If I have enlightened one person to the plight of those with A.L.S., I have done my job well.